So you got your MSW degree or you are working on your MSW degree and you're probably wondering what is next or what opportunities are out there for you. Today I'm going to break down the top 10 social work jobs for MSWs, and this is going to blow your mind because I think people typically think of, therapists or working for the government. And there are just so many jobs and so many different opportunities that go in between that. And I cannot wait to have this conversation with you guys. And make sure you follow, you like, you share, or share this with somebody that you know who might need this information, because this is really critical. Because before you know it, May will be here and graduation is around the corner, and we are going to need these jobs to be filled. So let's get into it. And if you are new here, my name is Adim Awe. I'm a licensed clinical social worker. I do a lot of other things, but today, for this purpose of this video, I am only a social worker with lots of experience as a clinical supervisor, person that's hired, and a person that is just familiar with the market. So the first job that I want to get into naturally is the clinical social worker, right? This is the therapist, and this is not going to be necessarily a job that you're going to be able to do right after school, because obviously you need to get your clinical hours. Now, there are some states that allow you to take the exam right after you graduate, so you want to look to make sure if that's one of your states. I don't want to misquote or misname any states and get anyone's, excitement up unnecessarily. So I'm going to encourage you to look to see if you live in a state that allows you to do that. But if you love one-to-one connection, you love therapy, you love to establish rapport, you are passionate about therapy, you can work in private practice. You could also work in a hospital. A lot of psychiatric hospitals hire us to do psychotherapy as well. Or you can work in schools, right? A lot of social workers do school social work or school counseling in the public school system and are the direct counselors or direct mental health professionals that these children meet with. And so that's a great way to kind of use this opportunity to intersect all these different populations. So you do need your LCSW, and if anybody's not familiar with the LCSW process, drop LCSW in the comments and I can make a follow-up video about what that process looks like. It does take time, it can be expensive, it can be very frustrating, but I promise you it is totally worth it. So the clinical social work, I definitely recommend this for the person who knows for sure they want to be a therapist, and perhaps you feel like your program didn't properly support you in becoming a strong therapist. Do not fear, because the thing about this field is that learning is ongoing. You can take additional trainings, you can take additional coursework. I know some programs have like additional trauma certification or CBT certifications or DBT certifications. Look to see if your program has any of those opportunities and take advantage of them, because that's going to help you in your skill sets as a therapist. And like I said, because this is a lifelong learning journey profession, you will have supervision. You will definitely take additional trainings within your workplace. And so I wouldn't fret too much. So the second job is sort of a medical healthcare social worker. These social workers work with patients, families, navigating tough diagnoses, psychosocial issues as they come up related to the diagnoses. So you're essentially the bridge between the medical system and emotional care, and sometimes social issues, right? And so you can be in a hospital, you can be an outpatient clinic, you can be in a home health agency. It really spans, because again, social workers show up in so many different facets and in so many different arenas. So anytime you can think of like where a doctor might be seeing patients, there's likely going to be a need for a social worker within that same setting. So think big, think wide. And if you have a particular interest around, maybe it's dialysis, right? I've worked as a dialysis social worker. That's a really cool job. Maybe you want to be more on the cancer side, oncology side. Oncology social workers is definitely a need. Or perhaps you want to be in a transplant, right? Transplant social workers are a thing and they do exist. Those social work jobs do typically are held off for licensed clinical social workers with years of experience, but it's not impossible to get. And so again, pretty much anywhere you can think where doctors see patients and patients are going to always have needs, us as social workers are always going to need to be there. And then that's going to lead me into my next one, which is a school social worker. Of course, you helping students handle social, emotional, and academic challenges. Yesterday, I actually met with the head of the school social workers for City of Boston, Boston Public Schools, and it was just so interesting to hear the different types of issues that they're working on right now, especially given everything going on in this country. And so social workers are coming together to make sure these kids have food, right? Make sure these kids have counseling and therapy support as they need them, right? Making sure like some of these kids are getting in trouble out in the communities. The social workers sort of bridging the gap between the school, the community, and the family to support these kids. So it can be a lot of work. But I think this is perfect for those of you who love working with kids or love working in education, right? If you have a knack for kids, you have a heart for kids, I think this is really a great way to get not only just great experience, but also these tend to be really stable jobs when you think about city, local government. Also, they tend to pay pretty okay, from my understanding. So I definitely recommend this for those of you who love working with kids, and maybe you're just burnt out from the child protection agencies, you're not interested in that. I would definitely look at this option. And you get like summers off, right? They work like 9 months out of the year and they get like 3 months off typically, and so that can be a cool setup, especially if you're already established, you have a family, or you have like a really ideal schedule you're trying to work towards, working around your family. This can be really good for you. Which then leads me to my next one, child and family social worker. So I mentioned child protection agencies may not be ideal for some people, and in that same respect, it may be the ultimate like goal for some people, right? And the cool thing about these jobs is just like, again, these are usually state government jobs. So they come with some level of security. They come with some pretty great benefits, including paying for you to go back to school, or paying, maybe if you're at your bachelor's level and they might be paying for you to go back to school to get your master's now. So like, congratulations, that's awesome. There's some other cool perks. It also just depends on the city or the state that you're in that you can look into, but these are cool opportunities for you. But these individuals, their goal is to protect kids, right? And to strengthen families and to advocate for stability and safety. And it can be really demanding and but it can be very meaningful work. So it takes a certain personality to know like if this is something that you want to do for yourself, or if this is a career that you see for yourself. And again, you can give it a try, like anything else on this list that I've mentioned. Give it a try, see if you even want to do it. If not, toss it. If not, keep it moving. And then we have policy analysts or advocates, right? So when we think of like macro social work and what that could look like, although it can have many faces, this is one of the things that kind of career currently comes to mind for me. So this is a perfect job for an individual that loves like the big picture change. Like you're really focused on change. You're really focused on the bigger picture, right? Not just on a sort of individual level, right? Which we tend to see in our one-to-one spaces or working in the community, but you're focused on resolving the bigger systemic issues at hand, or at least addressing them in some sort of way. So this is where you influence laws and, policies and systems change. So this is perfect for an analytical social worker who wants to impact policy. What I would recommend, or what this could potentially look like, right? Because that's sort of ambiguous and vague, is like city government, right? Running for city chair or something like that. Or perhaps it's like working around like, a local government around certain policies or issues, advocating for that. Sometimes it's, bringing people together to rally around certain issues, making sure that it stays as a, top priority for our elected officials, community gathering, community organizing. Like it can look so many different ways, but if you want to be paid for it, obviously it's, I would recommend looking at government, city, local, federal, however you want that to look like. And then, of course, kind of tied to that is more so program director or administration. So you lead programs, you manage teams, you drive change from the top, right? So you're management at this point. You'll shape how services are delivered at scale. Oftentimes especially for like newer grads or like MSW with like some years of experience, I see like nursing homes looking for like social service directors. I see looking for case management directors. And so this is for an individual who is passionate about leading programs, passionate about leading change, right? So when we're looking more so on that macro narrow lens, like I think this is a perfect opportunity for those individuals who really want to help shape how programs are delivered within organizations, shape how programs are, or services are provided within an organization. So you're interested in leadership, perhaps you're interested in like driving change within an organization. So this is perfect for you as for that individual. And then next, I have a forensic or criminal justice social worker. So this individual works in the courts, prisons, or reentry programs. You bring humanity and rehabilitation into the justice system. So this can look a number of ways. This can be look like assessments. This can look like therapy. This can be looking like an advocate. This could be looking like a probation officer, because there's a lot of overlap between probation officers in some sense and social work, and it's in respect to the criminal justice field. And so these jobs are cool because you can work with the courts, you can work with the jails, you can work with reentry programs, and it can really run the gamut. You can design your own, right? You can have your own reentry program. Of course, you want to follow your state guidelines of what that needs to look like, what needs to be in place. But who's to say that you can't start your own rather than working for somebody else, especially if you're passionate on it. There is the social work forensic association, where they'll do specialized training to familiarize you with forensic, like maybe evaluations, social work evaluations, or other evaluations that might be important or necessary to the work. So I highly recommend checking them out, and if that's something that you're interested in, getting more training in. And then next we have corporate social work, right? Our DEI specialist. So social workers belong in corporate spaces too, right? We have skills that are transferable. I talk about that all the time. And you'll promote inclusion, you'll promote ethics, you'll promote employee wellness. Sometimes it's you being in HR. Sometimes it's you being a researcher, right? We have social workers that are researchers. And so that social research is so important into understanding human beings, human interactions. And so corporate organizations look for this, right? And so sometimes, again, the roles are corporate responsibility. Sometimes the roles are DEI. Sometimes the role is like human researcher, or like it can really run the gamut. Wellness coach, wellness executive, things like that. So if you look at those type of roles, I would say, you want some years of experience under your belt as it relates to sort of program design, program leadership, program management. Not that you have to get those official certificates, but get some experience under your belt around those things, and that can help shape your resume to sort of land these jobs, or at least land the interviews for these jobs. And then obviously next we have the therapist, the entrepreneur, the consultant, the speaker, the person who does everything. Kind of sounds like me, right? So you build your own lane. You do what you want. You start out as a private practice. Your private practice doesn't have to look like everybody else's practice. You offer workshops. You offer consultations with organizations. You offer trainings. You get contracts. You write a book. You do whatever it is that you want to do. And that's the beauty in this. And that's why I love being in this space, because I get to combine all the things in sort of one setting. And so that is really cool for me to be able to do. So these are what I would say, or what I would deem as sort of the top social work roles. Are there more out there that I'm probably missing? Absolutely. But hopefully you feel like you have a little more clarity into what things could possibly look like for you, or what avenues you can potentially look like. And of course, if you have any more questions, make sure you drop it below so that I can follow up with you. And of course, thank you for watching. Until next time, y'all take care.